Here I'm going to talk about few question and answer about the NCLEX licensing exam. All question and answer regarding basic care and comfort. The first question, which action is contraindicated for a client who develop temperature 100 right, and Fahrenheit. In Celsius, 38.9 degrees Celsius. So my patient has a fever or hyperthermic condition, and examiner asking contraindicated. Number one, monitor his temperature every 4 hours. Number two, increasing body fluid intake. Number three, cover the client with a light blanket. Number four, provide low calorie diet. Imagine I do not sure what are the answers. Let me give you a clue to answer this question. Examiner asking contraindicated. The patient who have body temperature 102. Number one, monitor his body temperature every 4 hours. So body temperature is a vital sign, and my patient is not stable. So if patient is unstable, every 4 hours, check the vital sign, nothing abnormal. So the action is contraindicated. No, the number one is not a contraindicated. It is good. Every 4 hours, you check the vital sign because my patient vital sign is fluctuate. Temperature is 102. Number two, increase the body fluid intake. Nothing wrong. My body temperatures go up, hyperthermic condition, fluid intake is good. So number two is not answer. Number three, what action contraindicated? Patient is hyperthermic, body temperature go up, means fever. Body lost the heat, and you need to prevent the heat loss, or body temperature feeling hot but patient feel cold, and this is the reason covering the patient is with a light blanket. Covering the body with a blanket, nothing abnormal. It is makes sense. Why it is contraindicated? No, it is okay. Imagine the providing low calorie diet. I'm not sure number four is answer or not, but I'm sure number one is nothing bad, no contraindication, every 4 hours checking body temperature. Number two, increase the fluid intake, nothing bad. Number three, cover the body with a blanket because I have a fever, cold, I need to prevent heat loss. Number three is not a contraindicated. So number four is rest. Only one, which I'm not sure the answer, but I'm sure number one, number two, and number three is not an answer. So why not choose number four? This is the clue to choose the best option, because I know number one, number two, and number three is not an answer, and rest of one is the four. What is, I'm not sure. Now let me explain why number four is the answer. When a patient has a fever or body temperature increase, temperature is 102, means during the fever, the metabolism is increased, right? So if metabolism increase, your food is undergo to the chemical reaction, right? Calorie broken down. So if calorie broken down, you feel weak. Your body needs produce more heat, so you need more calorie. So provide low calorie diet is contraindication because you have to provide high calorie food, right? So it is the answer. So let me see what they said. Rational. Because a client with a fever has an increased the basal metabolism rate, he needs additional calorie in his diet, not fewer calories. Monitoring the client temperature, increasing his fluid intake, and covering him with a light blanket are the therapeutic intervention for a fever. Next question. A client is diagnosed with a gout. Which food should the nurse instruct the client to eat? Select all categories. So patient has a gout. So you know the gout, in case of gout, we can see the urine acid level go up. So gout is a disease in which defective metabolism of uric acid causes arthritis, particularly in the small bones of the feet. Right? So when gout attack or gout occur, patient complains severe pain and redness or tender of the joint. So it is good, we have to avoid the food contain the purine. So now question here, select all. Should the nurse instruct to eat? So out of the 6 options, the food which is contain the purine, better to avoid. Number 1, green leafy vegetables. Definitely it is the food for the gout because it does not contain purine. Liver must avoid, right? Cod, chocolate, sardine, eggs. So basically, high purine food better to avoid who have gout. So what are the food contain the high purine? Like liver, cod, and sardine or sea fish, right? The green or leafy vegetables, the chocolate or eggs is good for the patient who have gout. Rational. Client with a gout should avoid the food that are high in purine, such as liver, cod, sardine, seafood, as well as also kidney, sweet beans, lentils, alcohol beverages, particularly beer and wine. Green leafy vegetables, chocolate, eggs are not high in the purines, are acceptable foods to eat. Next question. Which laboratory test result in the most important indicators of malnutrition in a client who has a wound? So examiner asking laboratory test result, the most important, right? Who have a malnutrition in a client also have a wound. So severe potassium level, lymphocyte count, aluminum level, and differential count. Differential count is important if patient has an infection, neutrophil, macrophage, monocyte, right? Same as immunocompromised condition, better to check lymphocyte, SIB, lymphocyte, serum electrolyte imbalance, potassium level. Patient have a wound. My patient need good protein, right? Protein. Protein basically help to healing the wound, and albumin is one of the smallest form of the protein, right? We have to check it. What are the rationale? Protein and vitamin C help build and repair the injured tissues, means wound. Albumin is a major plasma protein. Therefore, a client albumin level help his nutritional status. Potassium level indicate fluid and electrolyte status. Lymphocyte count and differential count help to assessment for infection. Next question. A client is treated in an emergency department for acute muscle strain in his left leg caused by trying a new exercise. During discharge preparation, the nurse should provide which instruction? So patient talking about the acute muscle strain means pain, left leg, causes new exercise. So as a healthcare provider, what instruction we should give during the discharge? Like apply ice pack for first 12 to 18 hours, apply heat pack for first 24 to 48 hours, apply ice pack for first 24 to 48 hours, then apply heat pack. Number 4, apply heat pack for first 24 hours, then apply ice pack next 48 hours. What is the correct answer? Apply ice pack for first 24 to 48 hours, then apply heat pack. Explanation: the nurse should instruct the client to apply the ice pack to injured area for first 24 to 48 hours to reduce the swelling, and then apply the heat to increase the comfort, promote reabsorption of the blood and fluid, also speed the healings. Applying ice for first 12 to 48 hours may not keep the swelling from recurring. Applying heat for the first 24 to 48 hours would worse, not erase. Applying the ice 48 hours after the injury would be less effective because swelling already has occurred by that times. So applying ice also causes the vasoconstriction. If any bleeding there, any congestion there, it helps to stop. Next, go. A nurse can auscultate for heart sound. So during the auscultation, what should be the good position for the patient to best hear the sound? Examiner asking, a nurse can auscultate for heart sound more easily if the client is supine or on his right side, holding his breath or leaning forward. Correct answer is leaning forward. So what we learn from here? We learn if I leaning forward, the healthcare provider can get the heart sound more louder. So nurse can best auscultate for the heart sound by asking the client to lean forward and exhale forcefully. This position enables the nurse to listen for heart sound without the sound of expiration interfering. Using supine position to visually inspect the precordium, allowing the nurse to observe the chest wall for movement or pulsations or exaggerated left or strong outward thrust over the chest during the systole. Placing the client in a left lateral decubited position will make it easy for the nurse to hear low pitch sound. Next question. A mother of a 12 years old child expresses concern about the effect of child frequent thumb sucking. After the nurse provide instruction to this topic, which response by the mother indicate that teaching has been effective? First of all, find out the key point. So key point here, the child baby has a 12 months only, means 1 year, and frequently thumb sucking. So after the teaching to the patient and when mother remodeling, which one indicate mother understand it is? Number one, thumb sucking should be discouraged at the age of 12 months. I will give my baby a pacifier, but pacifier is a source of infection. Is not a good choice. Sucking is important to the baby. It is okay up to the certain time, but not for a long. I will wrap the baby's thumb in a bandage. Does not make any sense. What is the correct answer? Number three, sucking is important to the baby up to the certain time, but not a longer time. Mother has to know this. The rationale, starting there, the sucking reflex is the infant chip pleaser indicate effective teaching. However, thumb sucking may cause the malocclusion if it persists after age 4. Many feeders begin the sucking on their finger in utero and as infant refuse a pacifier as a substitute. So the mother who state she will give the infant a pacifier instead require more teaching. A young child is likely to throwing on a bandage, possibly leading to airway obstruction. Next question. A client is admitted with multiple pressure ulcer. When developing the client diet plan, the nurse should include, so pressure ulcer, diet plan, right? Number one, fresh organ slides, ground beef patties or steamed broccoli and ice cream. So when patient has an ulcer or wound or tissue injury, they need good nutrition and protein. So correct answer is the ground beef. So meat is an excellent source of complete protein, which this client needs to repair the tissue breakdown caused by the pressure ulcer. Organ and broccoli supply the vitamin C, but not the protein. Ice cream supply only some incomplete proteins and make it less helpful in tissue repair. Next question. A client has a blood pressure 152/86. Systolic blood pressure is 152, diastolic 86. The nurse should document the client pulse pressure. So pulse pressure it is a difference between systole and diastolic pressure. Means 152 minus 86. This should be the answer. Number 1, 66 millimeter of mercury. Number 2, 238 millimeter of mercury. Number 3, 86. Then number 4, 152 millimeter of mercury. So correct answer is 66. What is the pulse pressure? Pulse pressure is the difference between systole and diastolic pressure. So 152 is a systole, 86 is diastole. So what are the difference between these two numbers? It is the pulse pressure. So you see in this box, pulse pressure equal to systolic blood pressure minus diastolic blood pressure. NCLEX board sometimes asks what is means arterial pressure, shortly called MAP. Means arterial pressure represent the average arterial pressure during the cardiac cycle. How we calculate it has to be approximate because the period of diastole is longer than period of systole. We can count or calculate means arterial pressure equal to diastolic pressure means 86 plus 1/3 of pulse pressure. Means for this patient, pulse pressure is 66. So it should be 1/3 of 66 should be the mean arterial pressure. Next here. Question here. Sudoriferous gland secrete which type of substance? Sudoriferous glands means sweat glands. Other name of the sweat glands. Secrete, sweat, well, hormones, or cerumen. Correct answer is sweat. So sudoriferous gland. Other name is sweat glands. The function of these glands, they regulate body temperature, they excrete the waste product and maintain acid pH. In this picture, we can see sudoriferous gland or sweat gland. The rationale, sudoriferous gland are long and coiled shaped tubules that secrete the sweat through a duct on the body surface. Sebaceous gland secrete well, we call sebum. Endocrine gland secrete hormones. Together, ceruminous or sebaceous gland secrete the cerumen. Next question. A nurse is assisting with subclavian vein central line insertion when the client oxygen saturation drops rapidly. He complained of shortness of breath and become tachypneic. The nurse suspect the client has developed a pneumothorax. Further assessment findings support the presence of a pneumothorax include. So my patient has a pneumothorax. Oxygen saturation go drop and tachycardia and shortness of breath. What are the other sign symptoms, or what are the objective sign, right? So after examine what you get, diminished or absence the breath sound on affected side, paradoxical chest wall movement with respiration, trachea deviation to the unaffected side, and also muffled or distant heart sound. Pneumothorax means air inside the pleural space. Number 2, paradoxical chest pain, chest wall movement we only see in flint chest. Number 2 is not an answer. Trachea is deviated usually in case of massive pleural effusion, but our patient is a pneumothorax, air, not a fluid, right? Pneumothorax patient, if you put the stethoscope, you will get absence or diminish the breath sound. So in this picture, we say this is the trachea, and this is the lungs, and this lungs, right side, because of the air or fluid, lungs is collapsed, right? Pneumothorax or hydropneumothorax. Rationale, in the case of a pneumothorax, auscultating of the breath sound will reveal absent or diminished breath sound on affected side. So this is the lungs, right side is pneumothorax or hydrothorax. If you put the stethoscope, the breath sound will be diminished or absent. Paradoxical wall movement means when we inspiration or expiration, our both lungs symmetrically go up and down, or movement should be symmetrical. Asymmetrical or paradoxical movement is occur in case of chest injuries, ribs broken, and that is called failed chest condition. Trachea deviated occur in case of tension pneumothorax. So this is the trachea. Trachea should be midline, but it should deviated opposite side when tension pneumothorax occur. Muffled or distant heart sound occur in case of cardiac tamponade.